Ladies and gentlemen, now let's step into the sharing section by Dr. Tan.
So, thank you everyone. So, I will give an overview regarding glaucoma. So, what glaucoma means to the public and what can you do? And then, what as a doctor, we will give examination to the public during a glaucoma screening or glaucoma examination. So, without further ado, I will start my slides. So, glaucoma commonly declare himself as the silent vision thief. So, it slowly steals away your vision, and then by the time you detected it, you have glaucoma. Usually, most of the time, it's end stage, and then your vision will be severely affected.
Meaning that glaucoma actually cannot be detected in the early stage, is it?
Yeah, most of the time, because your visual field will affected but beginning at the peripheral visual field. So it does not really damaging your vision. You do not notice it. Once you start notice there is some blurring of vision, means that your central vision is already affected.
Meaning that if we want to know whether we have early stage of glaucoma or not, we need to go and do eye check regularly.
Yes, you are right.
That's the only way lah.
Correct.
Is there any symptoms of like, oh, we might be getting glaucoma in the
So
early stage?
if you have frequent headache,
Mm.
if you see lightnings, they might be a sign of glaucoma.
I see.
So you need to get yourself your eyes checked. Yeah.
Okay.
So what is glaucoma? It is a disease that damages the optic nerve, and it is usually associated with raised intraocular pressure. So it typically visual field and optic disc changes can be detected by our doctor, and it is one of the leading causes of blindness worldwide. In Asian, 1 in 100 Asians diagnosed to have glaucoma, and early detection and treatment can stop the disease progression. So this is the cross section of the eye. If you look at it, this is my pointer. Okay, so if you look at this cross section of the eye, what we notice here is the optic nerve is at the part here, and then the retina is on the side. So the optic nerve is very vulnerable when we have high intraocular pressure. So when we have pressure, it causes mechanical damage to the optic nerve. In return, over years, the optic nerves become damaged and die off. So give you a typical appearance of the visual field defect. So I will have more pictures coming up. So why is the pressure has gone up in glaucoma patients, right? So you must understand that in our eye, inside our eye, we generate type of water called the aqueous humor. This aqueous humor generated by the ciliary body at the back here. It gives nutrient to all the structure inside the eye. It flow out and get discharged and get drained by the angle of the eye. So most of the time in glaucoma patient, the drainage, the angle of the eye is at fault. As any form of abnormalities, they have become narrow or sometimes a functional defect. So the drainage of the water is deficient. When there's continuation production of the water, when the drainage of the water is at fault, so the pressure will slowly go up. So the intraocular pressure is responsible by the aqueous humor production and the aqueous humor drainage. So it can the pressure will go up because of the trabecular meshwork structure or the resistance, or because the angles are narrow. So the normal pressure in a normal human being is usually less than 20 millimeter mercury, or in both eyes that not more than 5 millimeter mercury difference. So when you have high pressure, the nerve will get damaged and press and get damaged. So we'll have a lot of typical changes over the optic disc. So what are the type of glaucoma? Like I mentioned before, that we have primary glaucoma, we have primary open angle glaucoma, we have primary angle closure glaucoma, and we have secondary glaucoma. And one type of glaucoma is very unfortunately found out in babies. When the newborn, we call congenital or juvenile glaucoma.
So how baby actually get glaucoma?
No, yeah, they are born with an abnormal angle. So it's part of the genetic disease where they're born with an abnormal angle. So the drainage of the water is being impaired. In return, the pressure gone up. So These kind of babies, right? When they first born, the eye will be not clear and sharp like the normal baby.
But then if how do we prevent this, or actually can we know about whether the baby got glaucoma or not during the pregnancy checkup?
Yeah. So when the baby is delivered, the doctor that handle the delivery will automatically check a full body checkup for the baby, including the eye. If let's say they found the eye is opaque, is not clear, so it will raise a suspicion, then they refer to the eye doctor. So as for prevention per se, there's no prevention. There's no supplement to take. There's nothing that you can do to avoid things from happening, for glaucoma from happening, unfortunately.
Meaning that if the baby is in like still in the pregnant stage, meaning that it cannot be detected lah.
Yeah, you're right. Inside the mummy's stomach, you cannot detect the baby has glaucoma.
I see. Okay.
Yeah. So one is very, very unfortunate. So this kind of baby will subject to surgery at a very, very early stage.
Oh, okay.
So, but the incidence of a baby glaucoma in baby is relatively very, very low in our country. So go back to the type of glaucoma. So majority type of the glaucoma in our country is a primary open angle glaucoma. So it's the most common type of glaucoma. It's always silent and almost always undetected. It always presented at the age of 35 to 50. And then within the 10 years to 15 years, it will enter the advanced stage. It's always presented at the advanced stage where the visual field is severely constricted. It's always painless, asymptomatic. There's no eye redness or swelling. Most of the time, the angles are open and then the pressure is very, very high. The optic nerve and the nerve damage is very classical. So the other type of the glaucoma is called the primary angle closure glaucoma. In this type of glaucoma, it can be divided into two types. One is the acute angle closure glaucoma and the chronic angle closure glaucoma. So the acute angle glaucoma, usually they come with the symptoms: sudden onset of headache, eye redness, eye pain, reduced vision. It might indicate the patient have acute angle glaucoma. So whenever you develop eye redness, sudden onset of eye redness, eye pain, single-sided headache, do visit the hospital or an eye clinic immediately. It might have an acute angle closure glaucoma. If you presented at this stage, your pressure will be sky high, about 30 to 50, and then your eye will be red, there will be a bit of swelling, throbbing pain and tearing. Then when we detect you, when we check on you, your cornea will be hazy, your angles are narrow, very, very high pressure. In this stage, if you detected it and give you management and operation, the optic nerve damage can be avoided and your vision can be salvaged. If you delayed it, blindness is inevitable.
Meaning that actually just now, because we know that the normal age of glaucoma presents is actually 30 to 50. Does that mean that other than the children baby, that one that unfortunately to get that one, does that mean that children and also maybe secondary school students they never get glaucoma?
Yeah, they have very low risk of developing glaucoma. So at the normal population, what we always advise is, in the current society and social economic status, when you reach the age of 35, do get your eye checked. Do get your eye fully screened and fully checked by a certified eye specialist. Not to optician shop, optical shop, but by a certified eye specialist. When you have family history of glaucoma, your uncle has glaucoma, your mother has glaucoma, the more you need to get yourself checked at the age of 35. If your eye is normal by the age of 35, you can screen it every 2 years. If you have some symptoms that's suggestive or suspect of glaucoma, you get your eye checked every year. Means that at every year, if I detect some progression, some early signs of glaucoma, I can start treatment early to prevent further progression or further damage. So this is as illustrated example how the glaucoma fields are like. So normal vision, no glaucoma, you see the visual field is very, very wide, very vibrant, and very, very nicely. You can see all around, right? When you start to have early glaucoma, the peripheral vision, you can look at here, it start to have dimming, start to be not so clear. As the disease advances, more the nerve got damaged, your peripheral vision become more narrow. And towards the end stage, you can only see the central tiny vision. Peripheral vision is totally gone. When disease progress further, the remaining nerve also die off and damage. Your nerve will be completely dark, will be blind. So go to here also, you can see as the disease progress, the field of vision become narrow and narrower, right? So this is typically very important for a functional young adult or a middle-aged adult when they are still driving. So imagine if you have advanced glaucoma, the cars or the pedestrian coming from your side, you're not able to detect it. So most of the time, they're gone into accidents. So early detection can prevent this from happening, prevent the disease from progression. And the patients will have advanced glaucoma, they are not certified to bring heavy vehicles or public transport vehicles. So personal vehicles, yes, but public vehicle, no.
But then right, as you can see that when the glaucoma is advanced,
Yeah.
then the sight is actually getting narrower and narrower.
Yeah, you're right.
So do government has any act to like prohibited all these like glaucoma people or patient to drive on the road?
Yeah, actually, for public vehicles, heavy vehicles like lorries and trailers, bus, they must have their eye checked by a certified eye specialist once a year before renewing their license, right? So let's say they have detected it's a glaucoma patient, it's an advanced glaucoma patient. Their license will not be renewed, supposedly. But as a personal vehicle, you drive your own car, it's still okay. But public vehicles like Grab drivers all cannot.
All right. So doctor, in your personal opinion, so just now you mentioned that personal car still all right. So what if the patient is in the extreme stage? Do you recommend him or her to go and drive?
No. So most of the time, when we break the bad news, we will tell them, at this stage, you are very, very dangerous to drive.
Okay.
So it's better for you not to drive and someone to drive for you.
Even if they are in the early stage, you will recommend.
Early stage is all right.
So all right.
Early stage is all right. We have, during our examination, we have some examination, some tests to do. So based on the degree of the visual field loss, we can kind of like advise patient, okay, you can still drive, or okay, you're not safe to drive anymore.
All right.
So come down to what I, as an eye specialist, when I come across a glaucoma or glaucoma screening or a public, what I usually do, besides checking your vision, I need to check your pressure also. So these are how we do our intraocular pressure examination by using a tonometer or a slit lamp. Usually they are painless, they are very fast, less than 10 seconds, it's done. So pressure monitoring is one of the very, very important factors in detecting glaucoma. So baby also, we have tools like this is called eye care. We can check babies and also young toddler, the pressure as well. Or as a screening tool, we have air path as well. So beside that, we also check your angle, to look at your angle, see whether they are open or closed. And then finally, we check on your nerve to look for any damage or not. So in this picture, this is a normal optic nerve, a normal fundus photo. You can see that on your left-hand side, there's a healthy, pink, little-looking optic disc with a lot of normal blood vessels coming out from there. From here, this is a comparison of how is a glaucoma nerve looks like. This is a normal nerve, pink looking, blood vessels are normal, nerve is very thick and healthy. As the glaucoma progress, when your pressure is not controlled, the hole become bigger. The nerve become thinner. And then the nerve become more pale, less pink. So as the final picture on the the left hand side is an advanced stage of glaucoma, where the nerve has already lost its thickness, becomes super duper thin, totally less than 10% of the original function left, and then the color also become pale, not like the pinkish in color anymore, right? So again, normal looking this. Oh, sorry, this is not normal disc with a little bit of bleeding over here. This is also a glaucoma optic disc. And these two are the advanced glaucoma discs. Look at the difference. It's very pale looking, very thin nerve. Again, more advanced. These are actually my patients that come to see me every day.
Every day.
Every day. So don't be surprised in Malaysia. We still have a lot of patients come to see the doctor presented at a very advanced stage. They think that it is normal cataract, nothing serious to do about. They're still handling their life until one day, really cannot see already. When they come to see me, actually it's not cataract. It is glaucoma. It's beyond salvageable. So after we examine your optic nerve, we need some tests to show that how many percent of your optic nerve functions are left over. So one of the tests is our visual field test. So from the picture just now, you can see the visual fields are all diminishing, right? So there is a computerized test, a more systematic test we can perform on patient. We can tell you how bad is the disease. Is it early? Is it moderate? Is it severe? And then how many percent left is the optic nerve function? 50%, 20%, or 10% left. So come down to treatment. Let's say if a patient is being diagnosed to have glaucoma by the eye doctor, controlling the eye pressure is very, very important. So before we counsel for surgery, usually we advise them to put an eye drop. There are a few eye drops in the market that can reduce the eye pressure by means of we have beta blockers, we have Zalatan, we can have fixed combination. So this eye drop, unfortunately, you need to use it most of the time lifelong until you die. So as long as eye pressure is controlled, your disease glaucoma will be controlled. Unfortunately, patients frequently develop side effect and allergy towards the medication. And some individuals, some patients also, despite of maximum eye drop, the pressure still not controlled. The disease still progress. At that point of time, then we will advise them for surgery. So I won't go into surgery because the purpose of the talk today is for screening purposes. So I will go through what are the other types of glaucoma. Just now we do mention, beside the primary glaucoma, we do have secondary glaucoma, which is the lens-induced glaucoma and the neovascular glaucoma, which is primarily contributed by diabetes. So the lens-induced glaucoma most of the time is created by neglected cataract. When you have cataract, when a person have cataract and then don't want to do cataract, the cataract become more and more matured, more and more swollen. It can block the angle and then causing high pressure. Because the angles are being blocked, the drainage of the water is being disturbed, so the pressure gone high, right? So the second one, diabetes. Diabetes is a very terrible disease, right? So we don't want diabetes to be uncontrolled. When it's uncontrolled, it develops a lot of these nasty blood vessels which can grow in front of the eye to give you the appearance like this. So these nasty blood vessels go and block your trabecular maxillary, block your angle. Your angle has been blocked. The drainage of the water also impaired. and then your pressure goes up. Then you have glaucoma. So usually in my practice, secondary glaucoma are frequently more difficult to manage than primary glaucoma. Most of the time they require surgery, and by eye drop, most of the time they cannot bring down the pressure. All right, so who is at risk for the public? Who is at risk? Why we should screen for glaucoma? Because glaucoma is it's a blinding disease. Early detection is important, and then start treatment is important. Elderly is at risk. Family history glaucoma is at risk. Those who always have chronic headache, always got a blurring of vision, get your eye checked. Maybe you have glaucoma. Those who have hypertension, diabetes, and cholesterol, do get yourself checked every year to prevent secondary glaucoma. All right, with that, I thank you.
Thank you so much, Dr. CK. So I actually have one question to Dr. CK. Just now, Dr. CK do say that there's treatment. Does glaucoma can be fully cured or only can be controlled?
All right, so there is some misconception regarding glaucoma. Okay, before that, we always say that glaucoma is non-curable. All right, so I will put it this way. Our job as an eye doctor, a glaucoma specialist, is to stop the progression and to preserve what you have. So most of the time, the patient thinks that when we do the surgery or control the eye pressure, your visual field will come back to normal. But unfortunately, whatever damage is already damaged. So my job is to control the eye pressure by means of medicine, eye drop, or surgery. Stop the progression and preserve what you have right now. Whatever damage is already been damaged. So the early I can intervene and stop the progression, the more vision function you can preserve and maintain. So if you ask me, can it be cured? It's a very trick question, because once I control the pressure, it's considered cure because there's no more progression. But when the patient come to ask me, cure means regain back the visual function that is already lost. Unfortunately, that is not possible.
So to detect the glaucoma, what kind of instrument that can for the detection?
So like I mentioned in the slide earlier, so those who are at risk to want your eyes get checked, so please go visit an eye doctor. So the eye doctor will check your eye, check your vision, check your eye pressure, check your angle, and check your nerve. And then, if possible, if the clinic has the facilities, we'll do the visual field test as well. So in Focus Point, in Excelview, we do provide that facilities. When you arrange an appointment with us, we can do all the glaucoma screening for you.
Alright, so before we end the whole sharing session, so Dr. CK, do you have any advice for the public?
In our current society and in Malaysia particularly, so those who more than 35 years old, I will strongly recommend you all to get your eye checked. Anytime. So go and visit an eye clinic, an eye certified eye specialist doctor. Get your eye checked. Make sure you are free. You are not at glaucoma, develop glaucoma. If yes, then get treatment early. If your eye is healthy, well done. Congratulations. Get your eye checked every 2 years. All right. So the blindness from glaucoma can be prevented. All right. Thank you very much.
Alright, prevention is better than cure. Thank you
Yes,
so
you're
much, Dr. CK. Thank you so much for your great sharing. Thank you.